Kathy, what is distinctive about the health, community and development approach?
I think what's distinctive is that in the field of public health and social development, there often tends to be a top-down approach where experts go to communities and impose community health programs on them. And I think in health and community, we are distinctive insofar as we really focus on the need to involve communities in every aspect of health and social development, from designing programs, planning them, running, evaluating them. Obviously, communities need to have alliances with appropriately supportive groups, but I think that community participation needs to be at the heart of any kind of successful public health or social development program.
How did your own personal experience inform the design of the MSc program?
I think there were two aspects of my personal experience that drove me towards this particular conceptualization of an MSc program, but over really 20 years of my career. The first was my involvement in South Africa in the 1980s in the anti-apartheid mental health movement, where I was very involved in work to provide counseling and support to political activists who'd been imprisoned and tortured by the apartheid police. As psychologists, we'd been trained in supporting traumatized people in very individual models. So you'd say to somebody, did you have an unhappy childhood? Are you good at coping with stress and so on? And I think working in the context of this particular political setting, it soon became clear that these individual models were completely inappropriate, and that rather than conceptualizing the individual as sick, it was really more appropriate to conceptualize the society as sick. In that context, we had to develop models of counseling that located the problem at the individual-society interface rather than within the individuals. That pushed me to think very seriously about the social determinants of health. The second influence on my development of the program, I think, was my involvement in the 1990s in South Africa in the design of HIV/AIDS prevention programs. And there the emphasis was very much on persuading individuals to change their sexual behavior by giving them information. And a lot of money, billions of dollars, was being poured into AIDS education programs, HIV awareness programs, and so on. And it seemed very clear to myself and my colleagues working in that setting was that people need information as the first step of behavior change. But a key step for facilitating behavior change and improved access to health is to work with people to understand the social context that place their health at risk, and to develop and design programs that seek to build health-enabling communities, community contexts that support and enable people to change their behavior. Simply telling somebody to change their behavior in a context where they don't have the power to do so is a hollow exercise. And that, I think, very much also inspired me to think about the social determinants of behavior and also the role that community participation had to play in the design and implementation of programs if they were to have any hope of success.
Why do students choose this MSc program over other programs in public health, developmental studies, or health policy, for example?
There's something about health that is intrinsically psychosocial. So if you're interested in the impact of social context on health, it's mediated through social psychological processes, and I think that that really is part of our added value on this program. As I've said already, I think in public health development studies, social policy, there's a notion of promoting health and social development in a top-down way. Experts go in and tell poor communities what they need to do to improve their lives. And what we're saying is that unless you engage communities, there's something about participation which is inherently health-enhancing. And Paulo Freire says people are most likely to change their individual behavior through working collectively with others to challenge the social circumstances that place their health and well-being at risk. And I suppose that that's really the orientation that we want to take. I think that social psychology has a key role to play here. Having said that, although the core course of our program is social psychological, one of our key strengths, I think, is our multidisciplinarity. So we have a strong social psychological core, looking at the way in which participation mediates between social context and health, but we also have a lot of options that students take from the Department of Anthropology, Development Studies, Social Policy, Media Studies, the Gender Institute, and so on. So we really do try and start off with the individual social interaction and then to embed it within a wide range of social psychological insights. And I think that that's something our students like a lot.
So what would you say is distinctive about the students from the program?
What is particularly distinctive about our students is that they come from a range of different countries and contexts. About half of our students come from North America, so it'd be a quarter from Canada and a quarter from the USA. I think the reason why we bring in so many students from North America is that in the US and particularly Canada, there's a particular interest in issues of social justice and community health amongst many students. And as far as I'm aware, there's not an equivalent program in North America, so that is part of our attraction for those students. We have wonderful students from South America who were all trained in universities where their teachers had been taught by people like Paulo Freire, Martin Barrow, who'd been very much steeped in the Catholic Church's liberation theology movement in the 70s and 80s. We have wonderful South American students. We have amazing students from various parts of Asia, South Asia. We have great Indian students. I mean, India is obviously a country which has a huge amount to teach us about people's health movements, about working with grassroots people to lobby government effectively to improve services and so on. We have a lot of students from Africa. We have students from Central Asia, Turkmenistan, Thailand. We have students from the Middle East, Lebanon, and so on. So it really is a fantastic melting pot of people who come from different countries and contexts. And all of our students, some of them are already professionals who come back to university to upskill themselves. But a lot of the students are in their late 20s, but they've all volunteered or done part-time or full-time work in the countries that they come from. And when we ask the students to evaluate the course, the thing that they always say right at the top is that the height of the experience was meeting the other students. You know, I think that's tremendously enriching, that they come with so much experience, with so much background knowledge, with so much cultural diversity. And when you put it all into the pots in the health, community, and development context, it makes a very rich mix and a very, very potent and passionate and seething learning environment.
Why is the London School of Economics such a particularly exciting context to be in for a program like Health, Community and Development?
The students like the LSE, I think, for various reasons. Firstly, as you're aware, the LSE has a long tradition, although sometimes people associate it very much with mainstream neoliberal economics and management and so on. The LSE has a long tradition of concern with social injustices, concern with social inequalities. So I think we have a very rich tradition of critical thinkers. They always say that half the people in the LSE want to make money and the other half of the people in the LSE want to change the world. And I think that we would identify very much with the second part. The other reason why people like the LSE is because of its multidisciplinarity. It's only a social science school, but within that there's a lot of rich diversity that can be gained from different disciplines. We have wonderful seminars. We have, as you know, international speakers from all over the world. It's a very exciting place to be. Another reason why people like the LSE, I suppose, is that in this fantastic mix of students, people make very good friends and excellent networks that they carry into their careers afterwards. You know, networks of work, networks of friendship. And in fact, just on the lighter side, whenever you put a bunch of kind of attractive, bright people together, relationships will develop, and we've had quite a lot of marriages. I mean, recently we had a Lebanese student who married a man from Mauritius. We had a Canadian student who married a man from Norway. It's just a very kind of wonderful and rich social environment, intellectually and personally. And the other reason why the students like the LSE, I think, is not so much to do with the LSE, but more about its location in London. London is obviously a kind of centre for a lot of different countries and contexts. London has 350 languages spoken, so it's a city of tremendous cultural diversity. And I think a lot of our students put a lot of effort into organising, a lot of effort, creativity, ingenuity while they're studying into organising volunteer experiences and internships in the range of agencies in London that serve international social justice causes as well as public health causes locally, within Europe and nationally. And that is very exciting. You know, we have students volunteering in organizations that want to promote social justice in Africa, or we have students volunteering in organizations to provide public health services to undocumented immigrants in London. There's a range of experiences that London offers students, I think, that fit particularly well with the LSE. And one of our old HCD students has been involved in setting up the LSE Volunteer Centre to try and facilitate volunteer experiences for students. And she's been a wonderful asset for our students in terms of bridges between the university and wider London, with its cultural diversity as well as its kind of high international global profile in terms of development agencies.